parents being prepared. But I'm hopeful that we open, that schools are full.
This is Barbara Ferrer, head of the Los Angeles Department of Public Health. You know those wise guys that have had our kids from the City of Angels in masks since our old friend COVID showed up? You might be asking yourself why this lady, who is not a medical doctor, is telling parents to be prepared for Los Angeles schools to not open for the 2022 school year. We all know how bad school closures are for kids, and this, my friends, is where our story begins.
Hi, my name is Katie Barnes.
This is Caitlin Barnes, or as her friends like to call her, Katie. In late 2020, she was hired by the Los Angeles County Office of Education to work on this COVID study that was backed by the CDC. Being a communications major, one might say she brought an interesting set of skills to the project.
Our task is to provide viewers of our website and our social media postings the potential to take information, analyze it, and come to a conclusion that may differ from what they've seen in other sources. These activities lead themselves to public diplomacy. Rather than mass communication, we hope to provide an alternate view of what the current mass media provide.
Now, this report was published by the CDC in September 2021, and it had all kinds of stuff in it related to COVID in Los Angeles schools, like the number of positive tests, guidelines to reopening schools safely, and even vaccine recommendations, even though vaccines weren't studied for the report. So who would hire someone like Katie to work on a report that she isn't at all qualified to work on? Well, that would be Deborah Eduardo, head of the Los Angeles Office of Education, where Katie works, and the lady ultimately in charge of the report on safely reopening Los Angeles schools. Now, you don't get to be superintendent without making lots of important friends in lots of important places.
In particular, I want to acknowledge my dear friend and exceptional colleague, Dr. Deborah Eduardo, Superintendent of Schools.
Kind of like Barbara, she's as important as they come in Los Angeles County. And when your dear friend runs the Los Angeles school system, maybe they can pull a favor for you. That's right, Katie is Barbara's daughter. And when Katie was working on this report for safely opening Los Angeles schools, she was living with her mom. And Katie put her mom and Debbie and the teachers union in the acknowledgement section of the report, along with members of her mom's staff. So you might be asking yourself, should someone without a medical background be working on the report that her not a medical doctor mom is going to use to set the guidelines for reopening Los Angeles schools safely?
I had nothing to do with that study. I didn't review that study. I actually didn't see that study.
Nah, move along. There's nothing to see here.
I think this is data from quite a while ago that really showed that you can open schools safely if you go ahead and integrate a whole host of protection measures.
Well, maybe after just thinking about it for a little bit, she does remember. This is Andrea Kim. She works for Barbara at the Los Angeles Department of Public Health and worked on the report with Katie. She says that Los Angeles schools follow the COVID health guidelines from a higher law of the land.
What's the data behind asking children to mask outdoors at schools?
We actually are following CDC's recommendation.
This is Rochelle Walensky, the director of the CDC. She runs the show at the Center for Disease Control and published Katie's report through the CDC's media blog, the Morbidity and Mortality Weekly Report. Now, this isn't a normal medical journal. It's a glorified PR website, and its articles are not subject to a mandated medical peer review. It's the place on the internet where the CDC can post anything it wants to call policy by just stamping their name on it and hitting the publish button.
2 studies will be published in today's MMWR. In their first report looking at COVID cases in Los Angeles County, evidence has repeatedly demonstrated that multi-layer prevention strategies, such as vaccination for all children and adults who are eligible, masks for all students, teachers, staff, and visitors, ventilation, cohorting, physical distancing, and screening testing, work to prevent the spread of COVID in schools.
So without a proper medical peer review, Walensky publishes Katie and Debbie's report on its blog site, which in turn stamps it as official CDC policy. Then Barbara and her staff at the Los Angeles Department of Public Health point to this report, which more or less writes the entire strategy for reopening Los Angeles schools in 2021. So the Los Angeles Department of Public Health points to the CDC. The CDC points to the Los Angeles Department of Education. So who does the Los Angeles Office of Education get their information from? Well, this is Cecily Mayart Cruz, head of the United Teachers of Los Angeles Teachers Union. In July of 2020, she published a survey sent out to union members outlining demands of what it would take to get the union on board to reopen Los Angeles schools. And the wild thing is, this list is exactly the same as the list used in Katie's report, but this is the first time we see this list of demands anywhere in Los Angeles County.
Here are the conditions that we must have: testing, physical distancing, masks, including those in TK through 2, hand sanitizer and soap, daily cleaning and disinfecting, ventilation.
So you might be asking yourself, what's the big deal? It sounds like everyone just wants to keep teachers and kids safe. And what's wrong with that?
The way things weren't working anyway. And so now this is a great opportunity to really reimagine, re-envision what public education could really look like.
Now, where have I heard this before?
You never want a serious crisis to go to waste. And what I mean by that, it's an opportunity to do things that you think you could not do before.
Well, all right, let's see where this goes.
All this gives me hope. Hope that we can come together behind a transformative vision for our schools and fight forward for racial and social justice. We are United Teachers Los Angeles, a leading edge force in the fight forward for racial and social justice.
That's right. Cecily has been blabbing all over town about how the COVID pandemic is really just the perfect opportunity to push her woke social justice agenda. Going so far as to having her union negotiators tell LAUSD that the union isn't really a union at all. They're a social justice group and they're going to do whatever the hell they want. And I don't know which tragedy is worse, that the low-income BIPOC kids that Cecily claims to be fighting for are actually harmed the most from COVID demands originating from the teachers' unions, or that she treats the kids of Los Angeles County as collateral damage to her mission in refusing to acknowledge the damage that she's done, saying that learning loss is just some made-up mumbo-jumbo, or that she focused on raises and bonuses during the September 2021 safety protocol negotiations with the LAUSD that were supposed to focus on safely reopening Los Angeles schools. And because Cecily wants to keep the COVID relief funds rolling in forever, there's no end in sight as to when she'll stop using the children of Los Angeles as bargaining chips during union negotiations. Now, you don't get to be the head of the Los Angeles Teachers Union and impose your woke social justice agenda on the kids without a little help from the inside.
We've used health officer orders to try to get around the sort of lack of, what I'd say strong worker protections.
Then we'll spend that week, as we always do, reaching out to our sector partners and our labor partners. Then, hopefully by the end of the week, we've got the county's plan.
We've also heard, as you know, as well from some of our union partners, are urging us to move much more quickly.
But I think, we really need to respect our labor unions and our workers and being able to negotiate.
Well, it seems like Barbara's PhD in social welfare is really coming in handy when her union partners are directly helping to finalize Los Angeles County's health plans. You'd think that the Los Angeles Department of Public Health would consider everyone when making public policy, but that's obviously not what's going on. And the most excluded are the kids, because when the United Teachers of Los Angeles Union politicizes the obvious last 2 years of student learning loss, well, this, my friends, is an open and shut case. And it's not just these COVID child policies that are trash. The COVID data that Barbara shares are twisted and spun so as to paint a picture of a threat and health emergency that just isn't there. This is Dr. Brad Spellberg, Chief Medical Officer at the LA County Hospital at USC. This hospital is one of the largest public hospitals and medical training centers in all of the United States, and the largest single provider of healthcare in Los Angeles County. This guy is a real medical doctor and actually qualified to speak on medical issues. Let's see if he's on the same page with Barbara.
Somewhere between 5 and 10% of folks that are hospitalized with COVID are still ending up in the ICU, and some of them are needing ventilators. This high rate of morbidity and mortality. This is not the flu, and this is not a cold.
Yeah, public health is scared.
A lot of people have bad colds, is what we're seeing. It's just the same. It's not changed. It's been the same. It's like 2 months of the same. Only 10% of our COVID positive admissions are admitted due to COVID. Virtually none of them go to the ICU. And when they do go to the ICU, they are not intubated. They are not these horrible 100% FiO2. We haven't seen one of those since February. It's been months. It is just not the same pandemic as it was, despite all the media hype to the contrary.
LA County is also experiencing continued increases in the number of COVID positive patients admitted to the 92 hospitals from 1,200 last Thursday to 1,329 today. 11% are in an ICU and 5% are on a ventilator.
As of today, we have approximately 40 COVID positive patients in the hospital, of whom by my count, generously, 5 were admitted due to COVID. One of those patients now is in the ICU, but that patient did not get intubated and is getting better and actually already has orders in the computer to downgrade out of the ICU. So what we've been seeing for the last couple months is continuing to hold as of now, as of today.
The stress on the emergency department is true. There are a lot of patients that are coming in for symptoms that are consistent with COVID. The urgent cares and the emergency departments are very busy.
You know, lots and lots of people that are sick.
None of those people have severe COVID. We have not had one of those in quite some time at this point. Right now, by my count, we have approximately 45 COVID positives in the hospital, of whom 5 were admitted due to COVID, none of whom have severe COVID, and actually don't need to be in the hospital at all.
1,242 hospitalizations reported today. Among those hospitalized who are infected with COVID, 11% are in an ICU and 7% are on a ventilator. We reported an average of 16 deaths per day over this past week.
4 of the last 5 days, we have had no admissions due to COVID, and none have been admitted to the ICU. Today, by my count, we have approximately 50 COVID positive patients in the hospital, of whom 2 were admitted due to COVID, one of whom just needs placement and isn't even sick.
I really have nothing to add to that. It's, as you say, more or less the same as it been last week, and the week before that, and the week before that.
Which story do you believe? This woman is going to try her damnedest to keep the kids of Los Angeles in masks to support the United Teachers of Los Angeles, even though it is hurting the kids. And there's much more to the story that includes how masks are magically not needed by adults, at the same time that they are mandated for kids, and how Barbara's bosses at the Los Angeles County Board of Supervisors received large sums of political donations from Cecily, and a radical group of concerned parents called the Snowflake Weepies that are sticking up for their kids and saying, no more masks. There's no better city in the world than Los Angeles. I've lived here my whole life and call it my home. I want my kids and your kids to enjoy and love this city as well, but that can't happen while this woman is calling the shots for the Los Angeles Department of Public Health. This is why it is your job to stick up for the kids of Los Angeles and get Barbara Ferrer out of office. Visit fireferrer.com to find out what you can do to end this bullshit.
So you don't believe that the public had the right to know to maintain your credibility with the public?
No, I don't. I think the public knows what they need to know.